Introducing the BladderScan BVM9500 bladder volume and bladder wall mass instrument. The BVM9500 uses non-invasive ultrasound to measure bladder volume and ultrasound estimated bladder weight, UEBW, bladder surface area, and bladder wall thickness. To measure UEBW, the patient's bladder volume must be between 150 and 400 milliliters. Within this range, UEBW, bladder surface area, and bladder wall thickness will automatically be calculated. The BVM9500 also provides the option to manually measure bladder wall thickness when bladder volume is between 150 and 400 milliliters. The BVM9500 consists of a battery-operated color display console, a handheld ultrasound probe that scans the patient's bladder, and a combination battery charger and wireless hub. Turn on the unit by pressing the power on-off button. To measure bladder volume, the BVM9500 is designed to scan in two patient-specific modes. Select the proper exam mode to ensure the accuracy of your scan. Press the button until the desired setting appears. Select to scan a male patient or a female patient who has had a hysterectomy. Select to scan a female patient who has not had a hysterectomy. Start with the patient in the supine position. Palpate the patient's pubic bone and place an ample quantity of gel midline on the patient's abdomen, about 1 inch or 3 centimeters above the pubic bone. Standing at the patient's right side, place the probe on the gel and aim toward the expected location of the bladder. For most patients, this means angling the probe slightly toward the patient's coccyx, or tailbone, so the scan clears the pubic bone. Press and release the scan button, located on the underside of the probe. When you hear a beep, the scan is complete and a bladder volume measurement is displayed. The scan is on target when 8 arrows flash on the probe screen and the bladder image is centered in the crosshairs of the aiming display on the console screen. If the scan is off target, the probe will show an arrow indicating the direction to move the probe to be on target. If the arrow on the probe screen is flashing, you are significantly off target and must re-aim and re-scan. The console screen will show a red arrow indicating the direction to re-aim. If the arrow on the probe screen is solid, you are slightly off target and must re-aim and re-scan. The console screen will show a green arrow indicating the direction to re-aim. You may also see a scan that indicates the pubic bone is inside the ultrasound cone. If this occurs, you may want to re-aim and re-scan. Although the bladder may be shown centered in the ultrasound cone and your measurement could be complete, there is a possibility that the pubic bone is obscuring some of the bladder. By re-aiming, you can ensure you have captured the bladder fully inside the ultrasound cone. If the patient's bladder volume is between 150 and 400 milliliters, the BVM9500 will automatically calculate ultrasound estimated bladder weight, bladder wall thickness, and bladder surface area. The patient's bladder volume must be between 150 and 400 milliliters to ensure an accurate measurement of UEBW. If the patient's bladder volume does not fall in the 150 to 400 milliliter range, UEBW will be blank. After you have verified an accurate scan, you may select from the following options. Record a voice annotation to save your exam. Please note that if you do not voice annotate the current exam, the exam data will not be saved. Print the exam result from the onboard printer. Make a manual measurement of bladder wall thickness. For more information on this feature, please see the BVM9500 Quick Reference Card or User's Manual. Return to the home screen and perform another exam. After you have saved the exam, you may listen to previously recorded annotations or review data from saved exams. The BladderScan BVM9500 has 2 review screens. Review Screen 1 shows bladder volume measurement results. Pressing the Return button displays Review Screen 2 with data on UEBW, bladder surface area, and bladder wall thickness. If a manual measurement of bladder wall thickness was taken, that data will be displayed on Review Screen 2 as well. If the bladder volume was not between 150 and 400 milliliters, UEBW will be blank. After reviewing exam records, you can return to the home screen and perform another exam. Once you have finished your exam, wipe the ultrasound gel from the probe and turn off the instrument. For users with ScanPoint imaging software, you may log on to ScanPoint to automatically transfer and save your annotated exams to your Windows computer. It's that simple. The BladderScan BVM9500 gives you the bladder volume and bladder wall mass information you need, quickly, accurately, non-invasively. The BladderScan BVM9500, Innovations in Bladder Ultrasound.